Today, the team's out in Newcastle chatting to people outside the hospital about blood clots, what they know, what they don't, and why spotting the signs early really matters. Let's find out what they have to say.
Hello, sir. Thank you for joining us today. It's World Thrombosis Day.
I didn't know that.
And we're standing outside a hospital. And so I just wanted to ask you, do you know anything at all about blood clots? What could you share with us?
I don't know much about blood clots, other than the fact that my father suffered with them terribly in his legs. And I'm a bit concerned about, I've got due in for an operation myself, and I'm a bit concerned about the hereditary link of blood clots from my father to me.
There definitely can be a hereditary link. So
Okay.
depending on whether your father had a genetic condition, it might have been passed down. But also, because you're having surgery, you need to be aware that surgery is also a risk for blood clots. So my advice to you would be, when you go in to have your operation, ask them to do a blood clot assessment for you.
Blood clot assessment.
Yes, please.
Fabulous.
Thank you for talking to us today. Good luck.
Welcome. Thank you.
Thank you for joining us outside the RVI today. It's World Thrombosis Day.
Okay.
Do you know anything at all about blood clots?
A little bit. I've not had anybody in the family that's had them, but I've had heart attacks and I'm aware of that for my circumstance.
So if you are admitted to hospital or anything, or you go into hospital for checks, do you talk to them about blood clot risk?
Nope, never been mentioned.
Okay. So my advice to you would be, if you do go into hospital, ask for a blood clot assessment risk when you're in there, because being immobile in hospital
Yes.
will increase everybody's risk of a blood clot. So please take care.
Yeah.
But thank you for sharing your views with us. We
Yeah, yeah.
appreciate it.
Okay.
Thanks a lot.
Thank you.
Bye.
Thanks.
Thank
Well
you
done,
so
ladies.
much. Thank you. Thank you for joining us today on World Thrombosis Day. You've got a thrombosis story.
I have, yeah. I went just for my normal well man check a few months ago, and it came back dodgy, that my platelets were a bit off. So I went away for a month. I went back, and my bone marrow is producing too many platelets. So I had to go for a bone marrow biopsy, and it's come back like my platelet level's now 597 instead of 400, I think it should be. So I was at the Freeman again 2 weeks ago, and I started hydroxycarbamide tablet, which is a chemo tablet. I started that a week past Saturday. I'm back in the Freeman a week on Thursday for more bloods to see if it's working. So I hadn't gone for me well man check, I would never have known, because there's no symptoms.
And that is amazing that you did, and that you're taking care of your own health.
Yeah.
So well done you that you did that.
Yeah.
But how lucky that you did that.
I know that, because there's the risk of clots, strokes, heart attack. So
And have you been learning about your condition?
I have, oh yes, I'm nearly an expert on it for a taxi driver.
And that's what you should do. And I can see all your mates having a laugh there. That you join.
But they haven't got a lollipop like I'm getting one, have they? So hey.
But it's amazing what you're doing.
Yeah.
Thank you for
No
coming
bother.
over and sharing to
You're
us.
welcome.
Thank you. I'm going to give you a leaflet
Yeah.
that you can learn a bit more about blood clots with as well, if
Right.
that's all right. Hi there. Thank you for joining us on World Thrombosis Day. You're obviously dressed in a uniform. What do you do?
I'm an occupational therapist for older people's medicine.
Amazing. So one of the things that I know about thrombosis is that after your age 40, the increase of a clot increases. Do you see that?
We do have patients that are admitted on the ward because of thrombosis as well, definitely. And it can affect them, not just physically, but mentally as well, because of the effects that it can have on them.
What sort of effects might that be?
Where just their range of movement, their limited mobility, and that affects them like every day to day, what they can do, what they can't do.
What kind of comes first? The lack of mobility causes the thrombosis, or the thrombosis and then they become more immobile, or does it vary?
I think it varies. Yeah, it varies. Everyone's different.
Thank you. One of the things I do a bit in a different role with elderly people, and I find they don't like to drink because they're worried about going to the toilet and they can't find it.
Yes.
But being dehydrated is a risk for blood clots.
Okay.
How do you encourage people to be hydrated?
Hydration is absolutely essential. Our hotel services make sure that the waters are constantly filled up every hour. So that's just one way to encourage it. We'll constantly make them drinks on the ward if they want tea, coffee and stuff like that, just to keep them hydrated.
Amazing. Thank you so much for sharing with us. Appreciate it.
Thank you.
Thank you for joining us today at World Thrombosis Day. Do you know anything at all about blood clots?
Not really.
Okay. So blood clot signs and symptoms. If you have a blood clot, you might find that your cough particularly gets swollen and red and painful. You might feel some heat in it, and there's a chance that a blood clot can break off from your leg and it can travel to your lungs, and that's when it becomes more dangerous. So if you developed a cough, if you were breathless, if you're a bit dizzy, those are things that could suggest a blood clot, particularly if you've been immobile. So if you've been in hospital and not moving, if you're pregnant, your blood is more likely to be clotted so that you don't bleed too much when you have a baby. So if you have any of those things going on, you're immobile, pregnant, then you could be at more risk of a blood clot. So if you've had any of those symptoms, it would be important to be aware of that so that you can seek medical opinion. Does that help you at all, is it? Mm-hmm. Okay, thank you for joining us.
No worries.
Thank you very much. Have a leaflet.
All right, no
Thank
worries.
you.
Thank you.
Head, shoulders, knees and toes, knees and toes. Head, shoulders, knees and toes, knees and toes. Eyes and ears and mouth and nose. Head, shoulders, knees and toes, knees and toes.
From head to toe, be blood clot aware. For more information, please visit our YouTube channel or our website.